talk radio.
Yeah.
Okay, I think,
You think we're ready?
yes, I can hear you now.
Okay, great. So I just want to reiterate that if you have questions and you're on Zoom, you can put the questions in the chat box and we'll get to them at the end of the presentation. The presentation's about 30 minutes, and so we'll have plenty of time for questions and answers. So welcome again. As I said, I'm a volunteer for Compassion and Choices. And Compassion and Choices is the nation's oldest, largest, and most active nonprofit working to improve care, expand options, and empower everyone to chart their own end-of-life journey. We believe in patient-centered care, where the person is in charge of making their own healthcare decisions, and also that people should be fully informed and supported by their doctors and their medical team on the full range of end-of-life options. Next slide. We apologize for the technical difficulties. Okay, so we're on the next page, Jay. Today we'll talk about the types of dementia and discuss the stages of dementia. We will also be discussing the tools that Compassion and Choices has developed to help you make plans for the future in case you do develop dementia. Next slide. But first I want to talk about how common the dementia is now, because in 2017 there was a major study done by the University of Michigan Medical School, and they studied 3.5 million Medicare recipients, and they found that out of 3.5 million Medicare recipients who had passed away, 47.2 of them had some dementia diagnosis at death. So it just basically is telling us that 1 out of 2 of us will suffer some form of dementia before we die. So, and that's very common, and that means we need to plan ahead for the possibility that we might be one that does develop dementia. Just some other facts from the Alzheimer's Association. We know that 2/3 of Americans living with Alzheimer's are women. We know that older Black Americans are twice as likely to have Alzheimer's, and that older Latin or Hispanic Americans are 1.5 times as likely to have Alzheimer's than white Americans, and that Alzheimer's kills more people than breast and prostate cancer combined. So it is quite a big problem, medical problem, and it is one of the top 10 killers in the country. And there are risk factors involved. Some are non-modifiable and some are modifiable. The non-modifiable ones are age. So the older we get, the greater our risk of developing dementia. Another non-modifiable risk is family history. Having a parent or sibling with Alzheimer's increases the likelihood of developing the disease. And the third non-modifiable factor is genetic factors. So certain genes have been found to significantly increase risks. And there's a gene that is abbreviated APOE, and don't ask me what that stands for because I don't remember what it was. But if you're concerned about whether you have that gene, talk to your doctor, because there is a test to determine if you have that gene. I personally would rather not know, but there is a test to determine that. People who have that gene are 4 times more likely to develop Alzheimer's. So those are the non-modifiable risks. But there's modifiable risks and things that you can do to prevent it. And those are high blood pressure. Keep your blood pressure under control with whatever way you can. Medication. They should want to make sure that your blood pressure is under control. Obesity is another modifiable risk. Maintaining a healthy weight is important for brain health. Smoking. Smoking is a significant factor for people developing Alzheimer's, so quitting can lower the risk. Diabetes. Proper management of diabetes is crucial, as it is linked to increased risk. And physical inactivity. So regular physical activity is associated with a lower risk. And depression. So addressing mental health issues and treating them is important for keeping good brain health. And then the last one is excessive alcohol consumption. So limiting alcohol intake can also lower the risk of cognitive decline. Next slide. What exactly is dementia? Where did that page go? Okay. Dementia is a progressive, irreversible disease with a decline in memory and difficulty in thinking and problem solving. It develops slowly and gradually worsens. Most cases of dementia last 8 to 10 years, but there's a wide variation in duration. In the later stages, it will affect behavior and personal care. Alzheimer's disease is the most common form and accounts for about 75% of the cases. But there are other forms. Vascular dementia, caused by a lack of blood flow to portions of the brain. Lewy body dementia, which is of shorter duration and often associated with Parkinsonism and other neurodegenerative diseases, and frontotemporal dementia, which is caused by damage to the frontal lobes. Like maybe somebody could have a stroke in the front of their brain, and that could cause that frontotemporal dementia. And so I went over the risks, and now I'm going to go on to the next slide, which is about the assessment scale for dementia. There are different assessment scales used to standardize criteria by which dementia is measured. The scale on this slide is the Global Deterioration Scale developed by Dr. Reisberg in the 1980s. There are other scales, such as the Functional Assessment Scale and the Clinical Dementia Rating, which only have 4 or 5 stages. In this one, the Global Deterioration Scale, Stage 1 is normal. Stage 2 is normal aging. In Stage 2, you have trouble remembering names. You forget where you place your keys. But you know which key works with which lock. You may not remember nouns or names, but you'll have little trouble coming up with correct verbs. Now, Stage 3, and I want to pass out a handout, so as we go over the rest of the stages, this will supplement the things that are showing on the screen and what I'm talking about. Because this handout has descriptions of the behaviors and what you can do, how you can support somebody with dementia through the stages.
And can this information be found on the website?
Yes, all of this information can be found on the Compassion and Choices website, compassionandchoices.org. And I'll repeat that again later, but write that down. So stage you'll see, like on this handout for the people that are in the room. By the way, people are online. You can get this at our website. But I'm going to read the important parts of it. So you'll see here, stage 1 is normal. Stage 2 is mild changes. They're not saying normal aging, but that's how we're categorizing it, normal aging. Now we're going to go on to stage 3. In stage 3, okay, cognitive decline is greater and there's increased forgetfulness. The cognitive decline is noticeable by others, and it's often called mild cognitive impairment. And if you look on, for those in the room, you can see the symptoms on there. They may have more effort, take more effort to remember appointments, manage money, and manage medicines. They may have trouble paying attention to a long presentation like this, or something that maybe you want to pay attention to but can't. And often people in stage 3 will have trouble with showing problems at work. So one of the things that we can do in stage 1, 2, and 3 is prepare ahead for a addendum to our healthcare directives stating what we want to happen at our end of life should we have dementia, okay? So now I want to talk a little bit more about mild cognitive impairment. The majority of people with it will remain the same and not deteriorate further into dementia. About 1/3 of the individuals who have mild cognitive impairment will develop advanced dementia within 5 years. However, some people who have mild cognitive impairment can improve their function, and there are many factors which can affect the results of mental testing. The amount of stress you are under, how you slept the night before, and your level of general health, to name a few. But I want to give you a story about Larry, somebody who was diagnosed at stage 3. Larry was a businessman who ran a plumbing parts business. And he was in his early 60s. He noticed a significant decline in his ability to run the business. Increasing numbers of errors were happening, and he shipped the wrong parts. His accounts receivable were skyrocketing because he forgot to send bills. So he sought medical attention, and he got evaluated by a neurologist and a neuropsychologist, and they did mental testing on him. And he was diagnosed with stage 3 on this scale, and mild cognitive impairment. Fearing that he would deteriorate and develop severe dementia, he sold his business, and he was expecting that he was going to decline and die in a few years. And then, but in about in a couple years, 2-3 years later, he realized that he was better, and he could be running his business. And so what happened? He got better. In retrospect, he was in a state of grief when he took the mental assessment test almost 4 years earlier. And his father had died a year before that. He was still grieving the loss of his father, and now he had to run the business by himself. So he just had so much on his plate that he just wasn't functioning like he needed to run his business real well at that point. But he didn't have dementia. He had mild cognitive impairment. But when the neuropsychologist told him he had mild cognitive impairment, which may develop into dementia, he heard it will develop into dementia. So this is sort of a warning. Don't jump to conclusions should you be diagnosed with stage 3 mild cognitive impairment. So he changed his life on one test and an incorrect assumption, and so we don't want anybody else to do that. So we'll move on to stage 4 now. Stage 4 is considered early or mild dementia, in which there is decreased memory of recent events, increased difficulty with concentration and problem solving, as well as trouble with tasks such as shopping. Typically, the life expectancy of someone with early dementia is 8 to 10 years. If we look on this sheet here, we see that it is adding to it that they forget where they leave things, like eyeglasses or phone. That happens to me all the time, and I'm not in that stage yet. But, they may have trouble, though, with things like doing the laundry, cooking, shopping. They may make more mistakes driving, or feeling uncomfortable and feel uncomfortable in unfamiliar places. They can have trouble with keeping up with their finances, unable to find the right words more often, increased difficulty with problem solving. So if you have a family member or a close friend, you can help them by maybe helping them with driving and some of the everyday tasks if they're in that stage. So moving on, stage 5, moderate dementia, shows a major memory loss, and the individual will need some level of assistance with the activities of daily living, such as getting dressed and bathing. Often the person in stage 5 repeats questions over and over again. And some people may have known or had family members or have had friends maybe even that would repeat questions over and over. That's a symptom of stage 5. The life expectancy of someone with moderate dementia is 4 to 6 years. So in this sheet, it's calling that moderately severe. And I think basically it's saying they might have trouble with eating and using the toilet. So, and choosing what clothes to wear. They may not choose the right clothes, like in the winter they might be wearing summer clothes or vice versa. So, and they may develop bladder problems. So, the support you can give a loved one with this in that stage is important. Now, stages 6 and 7 are considered severe dementia, in which the individual requires assistance with getting dressed, bathing, and toileting. There are major personality and emotional changes in patients with severe dementia. In the last stages, one loses their ability to carry out a conversation and the ability to control bowel and bladder function. With stage 6, the life expectancy is less than 4 years, and with stage 7, it's less than 2 years. And this sheet does cover that some people might have delusions, like they may think it's time to go to work when they've been retired for 20 years. So there's some severe changes when you get into that severe stage of dementia.
What was the life expectancy in stage 7?
Less than 2 years.
Are we in stage 6 or 7?
Yeah, in six it's 4 to in stage 6 it's less than 4 years. In stage 7 it's less than 2 years. Next slide. Earlier in the presentation, I mentioned we'd be planning for the future. Before you can make plans for the future, you need to ask yourself important questions. What are your values and goals? What matters most to you? What brings you joy? remember that delaying death in the case of a dementia diagnosis is not quite the same as prolonging life when you think about quality of life. And, like if I have severe dementia, I don't want to prolong my life. So I'm choosing to stop medications and not treat illnesses that come up because I want a natural death. But I'm going to give you some homework. We passed out a booklet here, and if you look on page 21, there's a values and priorities sheet there, or tool there. So, you didn't know you were going to get homework when you came to this class. By the way, we passed out booklets. For those online, these booklets are available online. You go to compassionandchoices.org, and in the very middle of the home screen, there's 3 bars which represents a menu. Click on that, a menu comes down, then pick resources. I'm not saying to do it now, but just remember resources. Then resources, you can find the dementia tools and the values survey. So anyway, in this booklet, you could do it online too, or have a booklet sent to you. Anyway, the folks here have the booklets. Take them home. Think about answering those questions so that you know exactly what you want at the end of life, what kind of care you want. Because when you do that survey and you answer that question, that is going to become an addendum to your advanced health care directive. Now, I hope everybody has an advanced health care directive. That is a legal document that tells people what you want in case you can't speak for yourself due to an illness, an accident, or a dementia. But the normal advanced healthcare directive that we have here does not really deal with the symptoms and signs and things that people who are facing dementia have. That's why we're suggesting strongly that you have an addendum that deals with the things that are going to come up should you develop dementia. And remember, 50% of us will. So it's best to plan for the worst and hope for the best. But you'll be ready if you do that. So next slide.
Is this nationwide or
The organization is, yes. Okay, someone was asking if our Compassion and Choices is nationwide. Yes. So if you have family in other states, they will have information for each state. So online, there is the same survey, and I just have to describe it. Like when you look in these booklets here, folks, you can see there's choices of 3 choices. They ask you important questions, like if you can't recognize your family, do you want to live as long as possible, or would you prefer to be treated for an illness but not aggressively, or would you like to just allow a natural death, which means no treatment, no intervention? It would just be comfort care in that case.
which page are you on?
It's 21, page 21 is the values survey.
I have your questions.
Do you have the page 21?
If you keep going to the next page, there's more questions.
Okay, because your questions aren't on 21.
So, it's important for you to think about what you want and then answer all these questions. At the end of the 3 pages, you sign it. It becomes an addendum to your advanced healthcare directive. And for those people doing it online, you can actually fill it out online, answer the questions, and then you can get your dementia addendum emailed to you, or you can download it as a PDF form, and then you sign it. You need to get 2 witnesses, and I highly recommend you get witnesses who will not benefit from your will. And then you don't need to get it notarized or anything. You attach it to your advanced health care directive, which you should already have. And if you don't, I have another presentation on that. But at the end of going through the program online, you end up with a printed version of it. In this case, with the booklet, you can just write it out, get witnesses to sign it, attach it to your documents, and that tells your family, your healthcare agent, your doctors, your medical system, what your priorities are if you can't speak for yourself. And next slide. Oh, wait a minute. Let me go back to that last slide. Because this one, I just want to mention that many of you know that we have medical aid in dying here in California. And so some people will wonder, if I get dementia, can I use medical aid in dying? No, you cannot. And the reason is because to use medical aid in dying, you have to have a terminal illness that is expected to end your life within 6 months. And you have to be mentally competent. But with Alzheimer's or other serious dementia diseases, it will take longer than 6 months for you to be terminal, and you won't be mentally competent enough to get medical aid in dying. So,
I want to point to page 28, because that's where you'll have these questions that you can then have witnessed and signed, whether the medical community will acknowledge and honor it, who's to say.
There's a lot of great tools in the booklet there.
But it's worth doing page 28 to page 32 at your leisure, if you really have a chance to think about it.
So-
And then, with your advance directive, give it to your doctor. If your doctor doesn't have it, it's not really going to help much. And so, with the advance care directive, attach this with the signatures and hope that you get what you want.
Okay, next slide. This one should say you can't do this alone, so keep going. I think I went out of order a little
That's
bit.
okay. You want to keep going?
I haven't, yeah, keep going.
Yeah.
Keep
Well,
going.
you're running
It
through
should
this-
say you
well,
can't
you're
do
running
this
through
alone.
Whole thing. More?
Yes? Okay. We consider this the most important part of the presentation. You can't do this alone. You need to let people know what you want, what your thoughts are. And these are difficult conversations at times, but very important. And I'm going to give you an example. It's a story of Jim. We love to tell stories. Jim was a doctor, and a medical doctor, and his parents both had dementia, and he had other people in his family too. So he kind of knew it was going to happen to him. So he started saving up prescription sleeping pills, and he stashed them away. And he hid him away so he'd have him down the line. But he didn't discuss it with his wife, his family, or even his friends. And unfortunately, by the time he wanted to use them, he couldn't remember where he had hid them. And so he did get what he didn't want, which was to descend into a severe dementia. 3 years after he died, his son found the sleeping pills in the well of his spare tire. So, so this is an example. You can't keep people out of the picture. It's very important to let people know what you want through this kind of advanced planning. Because if you don't, physicians and family members are left uninformed, and they will have to make agonizing life and death decisions. And there's the potential for you to get excessive care that maybe you don't want, because the medical system is about keeping people alive. And maybe if you have a Alzheimer's diagnosis or something, maybe you don't want to be kept alive where you won't be able to recognize people or function. So you need to let people know, and it actually could reduce your quality of life, staying alive in that situation, and that could increase your suffering. So it's very important to have all the advanced care documents in place. Next slide. I'm going to go on to another tool that we have. This one is only online. This one is called the Dementia Decoder. It's for people who have caregivers of people with friends or family with dementia, or people in the early stages of dementia. And this tool lets you pick what you would want should you have specific things. It'll assist you and your family members. Excuse me, I'm repeating the wrong thing here. This tool helps you prepare for a doctor appointment. And this is an online tool. The thing you see on the screen is where you say whether you are somebody that has the early stages of dementia, or you are a caregiver, or my loved one has it. Next slide. And it helps you focus on specific aspects of the situation and what you're most worried about. In this example, the caregiver is concerned about avoiding unnecessary tests, treatment, and pain and suffering of their loved one. Next slide. So the decoder gives you a bunch, whatever you say there, the decoder gives you a bunch of questions to choose from. Like there's 2 pages of questions to choose from, and you pick the ones that are the most appropriate for the situation. And then the decoder, next slide, will print out a list of the questions, and you can see on the screen it'll leave space so that when you go to the doctor, you're all prepared with your questions, and there's space to write down the answers. So it's a great tool for people supporting people with dementia, or if you're in the early stages of dementia. And as I said before, it's very important to plan for the worst, but hope for the best. Next slide. So Compassion and Choices, a little bit, has a very big website with a lot of tools related to dementia, so you might want to go there and check them out. There's different sites for different states. We also are the organization that works on getting medical aid in dying as a choice in all the states. There's currently 12 states and the District of Columbia where people who are adults and mentally competent can choose medical aid in dying if they're terminally ill. And we're trying to make it 50. But anyway, it's funded exclusively by individual donors because government doesn't fund this. Next slide. So if you appreciate this work, you can go to Compassion and Choices/donate and make a donation. Okay, this is another tool we want to suggest the book Finishing Strong. This was written by Compassion and Choice's former director, Barbara Combs Lee. She was a nurse who saw the treadmill of treatments and procedures and, all the things that happen to people in the elderly age, and she thought that was creating more suffering. So she wrote this book, Finishing Strong, to help you avoid the treadmill of care and choose what you want and plan for that. And it's available online or in any bookstore, probably. I don't know if it's in the bookshop Santa Cruz, though. But, okay. And now we're at the end of the presentation, and I can take questions. So, are there any questions online in the chat box, Tony?
So we're open to questions now. If you have a question online, you can just unmute. And
Does anybody in the room have a question? Yes.
I have several. So both my parents died of Alzheimer's dementia at 89. And they were basically okay till about 85.
Mm-hmm.
Is that pretty normal? And is that normal aging, or do you think that's Alzheimer's?
Well, if they were, she's asking about her parents who started getting some dementia at 85 and died at 89. And is that normal aging? No, because people can live perfectly cognitively clear, with maybe a little memory loss into their 90s or 100s. I mean, so, yeah, it is Alzheimer's, but as I said before, or some form of terminal dementia, as I said before, the older you get, the more likely you are to get it.
Okay.
So, it's just more likely to happen as we get older.
So then it would still be Alzheimer's.
Different people have a different perspective. Yeah, there's this testing, and I'm giving you these stages to help you identify if it seems like it fits in the stage, but everybody's different. And I can talk about my own health in that I had a heart attack at 61. I'm 80 now, this year. Okay. But and I did everything right before I had the heart attack, right? So, the science says if you eat right, exercise, don't smoke, blah, 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 right? You don't have to worry. It seems like that's what it's saying, right? But it's, everybody's different. And it's not always so simple, but this is a guideline to the stages, and like you say, you're noticing what's going on with her, and people around the people with dementia are really good resource for them, especially if they'll listen to you. Sometimes there's a stage where they go into denial, so yeah.
Any questions, but I want to make sure everyone else gets their needs met first.